Welcome to our poster presentation, which is on psychological approaches to treating pediatric asthma. So what is asthma? Asthma is a chronic lower respiratory disease in children characterized by variable airflow obstruction that is typically reversible. Symptoms include shortness of breath, coughing, and wheezing. Pediatric asthma affects approximately 8% of children, and its prevalence in the US is increasing, with higher rates seen in minority groups. Some physical and genetic factors are there's a genetic influence on asthma, which varies between 48 and 79%. So, genetic relationships to pediatric asthma depends on interactions in utero, neonatal interactions, and environmental factors. So, typically, there are comorbid medical and psychological conditions that are common with pediatric asthma. The number of anxiety disorders, such as generalized anxiety disorder, panic disorder, PTSD, and phobias, as well as depression, occur at higher rates in patients with asthma. Certain behaviors may predispose patients to asthma exacerbations, such as vaping, cannabis smoke, e-cigarettes. They all contribute to poor response to corticosteroids as well as poor control of asthma symptoms. Certain environmental factors, such as exposure to urban and city environments, exposure to animals, viruses, mold, pollen, dust, airborne chemicals, and cold air may also trigger symptoms.
And so the research has found kind of specifically to the physical biological aspects is that the HPA axis is heavily involved in that regulation of the inflammation, kind of that allergic disease expression, that allergic inflammatory responses. That inflammation of the airways, causes those hallmark symptoms of asthma, wherein kind of the airways become more narrow, the air becomes trapped, and kind of that flow of oxygen is very much decreased. Additionally, some of the research has found that the family unit and even caregivers as well, how well they are functioning is very impactful upon the prognosis of the childhood asthma. So the higher parental criticism is kind of associated with greater medical or treatment noncompliance. Whereas adolescents who have separated from their critical parents were met with kind of that better response to treatment and fewer hospitalizations over their lifetime. And social supports have been found to have modest positive effects on improving the child and the parent's ability to manage the asthma care for that child. So looking at this kind of from the learning theory, the goal is to kind of have the behaviors that are reinforced turn into habits that then become automatic after sufficient reinforcement over enough time. This is kind of done through those old school ways of conditioning. So the operant conditioning, the classical conditioning. So the operant, the consequences of that behavior. So for example, the using the inhalers, the asthma is an reinforcing behavior because it's the decreasing of their asthma symptoms. Their throat is no longer closed. Whereas some classical conditioning as well, you might then begin to associate that inhaler with lessening of your symptoms, so that it will then become a good association, or associating certain aspects of the asthma triggering events, whether or not it's animals or mold or things like that, and learn to avoid them. Looking specifically at social learning theory, the children are going to be more likely to imitate individuals that are perceived to be similar to them. So they're going to be more likely to watch parents or other people that might be going through this process as well, and learn how to engage in the treatment to stay healthy. And this is kind of done through a mediational process that was proposed by Bandura, going along the lines of attention, retention, reproduction, and motivation. So whether or not the child is paying enough attention to be able to learn the behavior, retention, whether or not they're able to remember it, reproduction, whether they're able to redo the behavior, which is using the inhaler, and then the motivation, whether or not they're actually going to engage in the behavior, which, considering it's a life-saving behavior, they'll be highly motivated to do that.
And so there's a number of ways that psychologists can help intervene and help children and families who have pediatric asthma. And one of the ways is to increase education and disease literacy for the child and their families. You want to help them manage any asthma-related symptoms, but also associated psychological symptoms such as anxiety and mood disorders. And we want to help them maintain a high quality of life. So some ways that we can do that: first, we want to evaluate the symptoms and their current functioning, not only with asthma, but with also their psychological health. And there's a number of questionnaires and self-reports that we can give to them. And then once we identify what the problems are, we can then intervene. And some of the things that we can do is motivational interviewing. So really wanting to increase youth and parent treatment adherence. We know that with any chronic illness, there's burnout when it comes to managing it long term. So we want to do anything to intervene with that and help promote adherence long term. We want to address any barriers to treatment and related deficits in resources to make sure that they have those. And then we can also implement some behavioral strategies. So just assisting and remembering to take their medications, how to use their asthma action plan, and to make sure that they are actually accessing what is prescribed to them. So thank you for listening to us, and feel free to reach out if you have any questions.
Welcome to our poster presentation, which is on psychological approaches to treating pediatric asthma. So what is asthma? Asthma is a chronic lower respiratory disease in children characterized by variable airflow obstruction that is typically reversible. Symptoms include shortness of breath, coughing, and wheezing. Pediatric asthma affects approximately 8% of children, and its prevalence in the U.S. is increasing, with higher rates seen in minority groups. Some physical and genetic factors are there's a genetic influence on asthma, which varies between 48 and 79%. So genetic relationships to pediatric asthma depends on interactions in utero, neonatal interactions, and environmental factors. So typically there are comorbid medical and psychological conditions that are